Mum is generally quite independent, but it is things like doing her bedding, helping support her around the home, tidying something up, to doing her washing, doing her hair when her hairdresser can't come, taking her food shopping, making appointments, taking her to appointments. It doesn't sound a lot, but when you're in it and when you're doing it, there is always a bit more and a bit more. I think mentally for me, working, caring for Mum, and the pressure of work, it really did affect my mental health, because I hadn't identified as a carer, I hadn't told anybody, because I felt I was just, doing a job that any daughter would do.
I remember it like yesterday, in that I was sat at home and I had a phone call from the hospital. Driving over there, it all went through my mind. How serious is this? Because I'd had a bit of exposure to stroke patients before, and I thought it can do untold damage. I was sort of in a bit of a trance, I think, to start with, because of what had happened. And I felt anger that she'd walked into the hospital and she was being wheeled out. I now know I'm a carer. I've accepted it. I think I was a bit in denial actually to start with, thinking I don't want to be a carer. She'll be all right. She'll get better. She'll be fine. She'll be able to do a lot more. I'd love to get out of here for a couple of hours or something and do something else, and then I think, what am I going to do? I haven't been down the pub for 5 years, so they probably aren't even there anymore.
I have a computer upstairs. I was working on the computer and I saw him walking up the road, and I recognised the Parkinson's gait. So to start off with, it wasn't too bad. We cut short the walks and things, but we carried on doing more or less what we had to do. But then he also had Lewy body's dementia. And then I did think, yes, I am a carer now. And then things started to happen, like he would walk out into the street, and because we've lived here a long while, people would bring him back. I mean, it was 6 o'clock in the morning. It was hard, and I didn't know quite how much I could go out and do things with and without him. So I went from being rather social and very sort of equal, to having to do everything myself. I think I was at a sort of crisis point, because on the whole, I've been a fairly cheerful person most of my life, but I didn't feel very cheerful then. And I did get around to going to a GP, and I did get away for a week, and that was important. And if you can arrange that in any way, even if you have to pay somebody, because later on I would have used a carer that I trusted rather than bring a relative in, but do try and get away. Do try and have some time for yourself.
Well, we started off when we adopted 3 kids, not siblings, arriving at 13 weeks and 2 years. And the younger 2 have learning difficulties.
Yes, so they are in their 40s, but they're still our children, and we care for them regularly and they're very dependent on us.
We tackled it as a team. We're good at different sorts of things, and if one of us is down, the other's up, and we can help the kids in different sorts of ways.
Previously, my mother had been in a nursing home, and my father wasn't managing on his own at 89, and one day he just sent me an email that said, "Can we come and live with you?"
When Jack and Margaret came to us, I didn't think of ourselves as carers, and it wasn't really until I got involved with caring together that I realised we weren't just mother and father and son and daughter, we were carers. And that's kind of very interesting to realise how many people who are carers simply don't realise that's what they are.
It is so important you look after yourself. You put your oxygen mask on first, and if you're in a bad way, you're not any good to the people you're looking after. So self-care is important, and it's not selfish. I don't think that ever occurred to me in the hard times when we were bringing them up, but it is, and I would say to somebody taking on a caring role now, look after yourself.